All right. Hi, everyone. I am Aditi. I'm a first-year resident at my program, Atlanta VA Healthcare System, and I'll be presenting this PowerPoint. So it's a podiatry residency program, PMSR, RRA, and we take 2 residents per year. So total, we have 6 residents in our program. Our program director is Dr. Rizzo, and our assistant program director is Dr. Gori. Next slide. So a little bit about our program. The Atlanta VA offers a comprehensive 36-month podiatry medicine and surgical residency, which includes training across podiatry medicine, podiatry surgery, reconstructive techniques, and advanced wound care. The program is designed to give residents strong clinical exposure, excellent surgical volume, and then meaningful mentorship, all within a structured educational environment. So this main training site is a 152-bed level 1A, trauma 1A inpatient hospital. And this facility serves more than 400,000 veterans across the region, which means that residents see an incredibly wide range of pathology, from like routine foot and ankle condition to like limb salvage cases here in this hospital. And because of this diverse patient population, we gain valuable experience in all like multidisciplinary care, where we work closely with vascular surgery, infectious disease, internal medicine, and other teams. And in addition to the main VA campus, residents also rotate at several different sites. These include the Martin Army Community Hospital, which is an active duty hospital where we get additional exposure to surgical procedures, military medicine, and lots of trauma-related cases. And then we also rotate with local podiatry private practices that operate ambulatory surgery centers. And this rotation also provides insight into private practice workflows, outpatient surgery, and we see a lot of management of foot and ankle conditions and surgeries. And this is a slide of our full-time VA attendings. I don't think we're missing anyone. This is our director, Dr. Rizzo, and this is our assistant director, Dr. Gori, who is also a fellowship director. And these are our full-time VA attendings. Dr. Rizzo is our program director, residency program director, and assistant chief of podiatry. Dr. Gori is also assistant program director, and he's a director for the limb vascular podiatry limb preservation fellowship program. Dr. Salvo is our chief of podiatry, and Dr. Carbonell is our clerkship director. So as part of our residency program, we also rotate through several key medical and surgical specialties, services including anesthesia, internal medicine, infectious disease, imaging, and pathology during our first year. And I want to highlight the pathology rotation in particular because it's unique, and because for pathology, we spend 2 weeks at Baco Diagnostics, which is located about 40 minutes from the VA hospital here. And this rotation is structured like a mini fellowship program, so giving us an in-depth look at the entire diagnostic process. And where during this time, we go behind the scenes to see exactly like how specimens are handled, processed, and from like start to finish. We observe the workflow in the lab and watch like how the slides are prepared, learn how the pathology team interprets and studies those slides, and also detailed instructions on how like different types of biopsies, what to perform, how to perform correctly, and how to avoid like common pitfalls, which is just as important. and also learn like where the ideal biopsy sites are and different types of sampling techniques. And for our PGY2, we do rotate at general surgery, emergency department, mental health, endocrinology, rheumatology, and podopediatrics. For podopediatrics, we rotate through a private clinic and where we get our numbers easily. And for our PGY3, we rotate with vascular surgery and plastic surgery. So some of our external rotations take place at surgical and military medical centers, which really enhance our training experience. One of these sites is the Atlanta Center for Reconstructive Foot and Ankle Surgery, which is located in Sandy Springs. So this is a ambulatory surgery center about 20 minutes from the VA. Here we are exposed to a wide variety of surgical cases, ranging from forefoot to rear foot procedures. And this rotation, primarily second and third years are rotating as of right now. And another important external rotation is the, which I already mentioned, Martin Army Community Hospital in Fort Benning. And this is an active duty military hospital, which is also located 2 hours from the VA. And for this rotation specific, we spend a month in this rotation where the VA provides funding for the lodging during these rotations. And at this location, we see a very large amount of rear foot and ankle trauma cases related to military training injuries. For example, we frequently encounter trauma from hard to improper landings during parachute trainings, leading to significant ankle injuries and fractures. And this rotation gives us excellent exposure to military medicine, any like high energy trauma, or very diverse foot and ankle pathology. So it's a very unique experience that broadens our clinical and surgical perspective beyond the typical civilian environment. And some of the other external rotations, which I already mentioned, was BACO for pathology, is a 2-week mini fellowship program. And again, highlighting that it's 40 minutes away from the VA hospital. And BACO also is providing housing, and then they reimburse miles. So if you are like commuting from Atlanta, like if you live near the VA hospital, and if you're commuting up like north, then BACO also reimburses those miles. And if you, because of the traffic, if you want to stay at one of their houses, then that's also provided. And the other ambulatory surgical center is located in Forest Park, where the first year start going early and scrubbing those cases. And here too, there are also different attendings, so you can learn from these different attendings. And for didactics, from a didactic standpoint, our program provides a very structured and well-rounded education schedule. So Tuesdays are our primary didactic days, since our main OR days are Wednesday and Thursday. So every Tuesday, we present the surgical cases scheduled for the week. So the resident who is primary on each case presents the clinical background as well as like surgical methods, and also like an article that is relevant to the planned procedure. So this kind of helps like resident and everyone review the like recent literature and discuss surgical approach as a group. So every third Friday of the month after our surgical case presentations, we hold journal club, and during the journal club, residents choose articles on topics of interest and lead these group discussions. And this also helps us opportunity to stay current with the literature and then strengthen our critical thinking skills with the discussions. On the last Tuesday of every month, each resident is assigned a board review topic. We prepare and present that topic to the group. and then which builds a strong foundation for board preparation over the course of residency, and you won't forget those topics. We also have several recurring didactic sessions throughout the year, including bi-weekly virtual biomechanics lectures in the morning and a bi-weekly surgical M&M conference with the entire surgery department where cases are reviewed and discussed. Additionally, we also participate in the quarterly BIS and 7 joint residency program didactics, which brings together the residents from various multiple programs across the region. We also provide hands-on workshops, which are integrated throughout the year, such as dressing workshops, suture workshops, and other skills that we need to for the residency to refine our technique. And our program also offers extensive research opportunities as well. So the podiatry team works very close with, I especially want to highlight the infectious disease and vascular departments. We have like joint meetings with infectious disease to review like complex patients, and residents are always encouraged and supported to initiate or join this ongoing research projects or like come up with one. And then we also attend the Georgia Podiatry Medical Association meeting as the conference as residents. And this year's conference will be held at the end of May. And it provides great educational session as well as networking opportunities. So we also have a joint podiatry fellowship, podiatry vascular fellowship program where Dr. Gori is the fellowship director. So please reach out to Dr. Gori with any residency or fellowship questions. Other than that, I also want to add one thing I would add is our on-call schedule. So everyone takes call here. Primary first years are the ones that taking more call, but typically first years are taking anywhere between 10 to 15 days of call per month. And after that, each day is divided between second years and third years and fellow. So we have a great on-call schedule. And yeah, things to do in Atlanta. You can go visit the aquarium, Ponds Market, Beltline, Stone Mountain Park. There are lots of things to do here. It's a very vibrant city. And yeah, please let me know if you have any questions.
Yeah, I have a couple questions. Do you guys, one question I would say is sometimes residencies will favor students that do an externship. Uh, is that kind of the same way with you guys? You prefer your students to extern with you?
So
If it's all right,
yeah.
I'll go ahead and chime in since I'm involved with that.
Yeah,
Ideally, it's ideal to have an extern. It does give you an advantage only because you've had 30 days
yeah.
or 31 days to be with us and for us to, get to know you. It takes a lot of the edge or the unknowns away especially when you go into a situation when you're interviewing a candidate that it's either only visited or has not even visited, but is showing up for the first time during the interview process. So I will say there is an advantage only that we have more to go by and we have a better feeling from it. But is it the end all be all? Absolutely not. We welcome any opportunity, and we've even had great candidates as well as great residents that have come just from interviewing them a single time.
And how about another follow-up question? How about case variety? Because I feel as
What
though, being a former resident, and going through the process, I always felt like I don't think numbers really are matter. I think numbers are everybody meets their numbers. I think what's more important is variety in cases.
I'll answer and then I'll let Aditi and anyone else chime in as well. But as a graduate of the program, I can tell you the program has only gotten better, and the biggest single-handed difference from when I was a resident to what the current residents have right now is Martin Army Community Hospital. That is an active jump school that participates with jump school occurring 3 weeks out of 3 out of every 6 weeks. They have active jump programs, and during that time, if you've been in the military, bad things happen, and that's a fortuitous event for those that are training at the facility with high ankle or high lower extremity trauma and reconstructions that are not always done the way that the books teach you or that traditional residency programs treat you or teach you, I should say. And so that single-handedly has changed the dynamic of our program to being even more well-encompassing and more diverse and favorable for residents to get their training and be well prepared coming out.
Yeah, thank you.
Absolutely.
Um, Anything else to add from you guys?
It's a great program. Dr. Rizzo and myself were always available. We welcome students to that, and they've been doing it quite recently and quite often. Joining us for our academics, we do strive for academic awareness as well as we push our residents to participate actively, not only in in-house academics, but also in pushing them towards publishing, public speaking, poster presentations, in interfacility and intrafacility presentations, and we welcome adding to what we already do with group dynamics and group academics that we perform with our infectious disease colleagues, as well as our vascular surgery colleagues. We have integrated academics to allow for our residents to participate within our fellowship program as well, and the inherent academics that come with the fellowship program. So there's a wide variety of academic materials and events to which our residents and our students are able to be a part of.
Yeah, I definitely think it's important if you want to go to a specific residency to attend their academics.
I
Especially,
think a lot of I agree with you. Back in my day, I should say this wasn't something that was easily available, but with the nuances of Zoom
yep.
and Teams and all that, it's made it to where the access is so much better, and you can actually get a feel for a program even by just tuning in for academics either one time or multiple times, and we welcome that at any time.
Yeah. Well, it was great having you guys. I think it was really good, and I really appreciate you guys joining us for this. This is something I really wanted to start to get residents awareness out there. We record these and we put these up for the students to be able to watch anytime if they want to select a program they're interested in and go through. So, best way of contact either through Dr. Rizzo or anybody.
Yes, you can contact Dr. Rizzo and at the email that's provided on the screen, or you can contact myself. Mine is Shahzad, SHAHZAD .Gori, GHORI at VA.gov. Both of us are very well privy to messages both during and after office hours. And even our clerkship director, Brian Carbonell, again, it's brian.carbonell at va.gov, is also equally available, and we are always willing and ready to help with students in their pathway towards obtaining and completing residency.
All right. I appreciate you guys. You guys have a good night.
You too. Thanks for the opportunity.
Yeah, absolutely.
Thank you.